My name is Diana Nichols. I'm a wife and a working mom of 2 little girls, and I'm 37 years old, and 10 weeks ago I had hip replacement surgery. I was first diagnosed with arthritis about 7 years ago after the birth of my first child. It's likely that the joint had started to deteriorate before then, but pregnancy, the weight gain during pregnancy, and a year or so of carrying a child on my hip probably just sped up the process. During that time, I saw 4 different orthopedists, hoping that one of them would have some kind of a miracle treatment that would make everything better. I read Dr. Theo DeSakis' book, The Arthritis Cure, and started taking glucosamine and chondroitin sulfates, and also took anti-inflammatories to help manage the pain. But the bottom line was this, that I would likely have a total hip replacement before I turned 40. Anyone who has arthritis knows how painful simple daily tasks can be. Tasks like climbing stairs or going to the grocery store. And yet I continued to exercise, I had another child, and I continued to live with the pain. Chronic pain that started deep inside my hip joint and shot down the entire length of my leg. It got to the point that my quality of life was compromised, and it was then that I finally started to consider having the surgery. My age, my children, my active lifestyle all made it a very difficult decision. I think intellectually I knew that I would be better off after the surgery, but I just couldn't imagine myself being a full-time mom and recovering at the same time. But I scheduled the surgery for June 19th, and I gradually got used to the idea. It was purely by chance that I heard about Dr. Bramlett. I had run into a friend of mine who I hadn't seen in a while, and she told me about Dr. Bramlett's arthroscopic hip replacement and said that I ought to give him a call. So I did. After one consultation, it was obvious to both me and my husband that I needed to cancel my surgery in Mobile and come to Birmingham, so I did. On June 25th, Dr. Bramlett used a 2-incision procedure to place a conventional hip prosthesis in my left leg, and by that evening I was taking steps. Using a walker, I went short distances, but with Dr. Bramlett's and Carol Wells' encouragement, I had more and more confidence with every step I took. After a couple of days, I quit taking pain medication, and within 1 week, I was walking unassisted without using a cane or a walker. I was also driving a car. My energy levels started increasing, and I was able to come back to the gym 2 weeks following the surgery. I did the recommended rehab of 30 minutes on the bike and leg exercises designed to strengthen the muscles surrounding the joint. Exercise has always been important to me, and being able to come back to the gym so soon after the surgery seemed nothing short of miraculous. 2 weeks after major leg surgery and I can ride a bike. It's truly amazing. These are my scars. The front long one sits right on top of the hip flexor. This is where the hemovac was. And this is the back one. Of course, once an athlete, always an athlete. I have a tendency to push myself. 4 weeks post-op, I was feeling really strong and confident, and I wanted to do more. So with Dr. Bramlett's consent, I started doing light weightlifting and working out on the elliptical machine about 45 minutes with moderate resistance. About a month after the surgery, I came back to work. Only work was in a new building, and my office was 3 flights up. They had elevators, but I choose to walk up the stairs because it's better for you and because I can. And this is where I work. That's Brooks.
Hi there.
I'm an art director for a marketing firm, which is mostly a desk job, but occasionally I'm required to go on location to supervise photography. That is probably the most physically strenuous part of my job because it involves long days and coordinating many people and props. Well, as it turns out, I had a photo shoot the very next week, which was 5 weeks post-op. I had no limitations from my hip. I was able to do exactly what I needed to do, and everything turned out great. My first checkup was at 8 weeks, and I was anxious to find out what I couldn't do. I knew what I could do, and I needed to know what my limitations were. At this point, I was completely uninhibited by my new joint, and I wanted to start doing spin classes again. Not only did Dr. Bramlett give me the green light for spinning, but he also suggested I could start fast walking. So I started working out on the treadmill, and something I haven't done in 7 years, and I'm working up to a jog in the near future. I find it remarkable that after 10 weeks I have few, if any, limitations. I feel very fortunate to have had this new surgery and been under the excellent care of Dr. Bramlett, Carol Wells, and their staff. And I would, without hesitation, recommend this procedure to anyone facing a total hip replacement.